Could you have your menses while being pregnant at the same time? Now let's discuss this topic with a very special patient case study that we had recently. So this patient, she was previously diagnosed with PCOS because she was trying to get pregnant. It was diagnosed that PCOS was affecting her ability to get pregnant. Once she had that treated, she was anxiously trying to get pregnant, and then it never really happened, but she's keeping it in progress and always very anxious about it. So in this month, which is the month of August, on the 3rd of August, which is 2 weeks ago, she had her menses as per usual. So she was very disappointed. She said, "Oh, yeah, I'm not pregnant yet." So she was going to try again to get pregnant, but just for the sake of it, she did a pregnancy test just to confirm it, and she was found out to be positive. Her pregnancy was positive. She was in fact pregnant, but she was very surprised as in how could she be menstruating as per usual if she was pregnant. And then furthermore, usually her menses will be completed within 3 to 5 days as per her normal cycle, but for this type of bleeding it was lasting way past 5 days, up to 10 to 12 days. This is what she told us here at Antai Hospital when she came for diagnosis, and immediately we can already confirm that bleeding that she had experienced on the 3rd of August was not her menses, but in fact bleeding from the pregnancy, her gestational sac. Something is affecting her pregnancy. She was already pregnant, which she was clearly unaware of, and something is causing the bleeding from the pregnancy. So upon diagnosis, upon doing an ultrasound, we can immediately diagnose that she was facing an ectopic pregnancy, a tubal pregnancy, which means the pregnancy is implanted in the fallopian tube because it was being implanted shallowly, thus causing this bleeding, and also the low levels of HCG that we found in her blood. So usually for somebody like her, which we already diagnosed that her pregnancy was in the 41st day already, she should have at least 2000 milli-IUs of HCG, but in fact she only had 500, which means this HCG is declining, which means this pregnancy is not developing well and may potentially end. So upon diagnosis, we immediately recommended her to do a laparoscopic transplant surgery where we can transplant the current embryo implanted in the fallopian tube directly into the endometrium without having to terminate her pregnancy. Well, I hope this video can give you some form of information and awareness that if you do have some form of bleeding during pregnancy, it has nothing to do with your menses. That means something is affecting your pregnancy, something is causing this